All right, and so welcome back for another week of our chats about resources across the state and just providing some sort of social connection in this crazy time. I was actually joking with Aaron earlier that these meetings are the only regularly scheduled thing I have anymore. So it's basically 100% of my guidance on where I'm at in the week. It's like, oh, I've got one of these meetings. It's trash day, or the weekend's almost here. So it's such a crazy time that hopefully doesn't last too much longer. But who knows? So this week we're here to chat with some different health resources. We got Katie from the Lewiston CBOC, and then hopefully we'll have some vet center representation shortly. There was a good showing of them that were interested in being here, so maybe there's just some difficulty with the link or something. We'll work on figuring that out. So Katie, feel free to go ahead and explain what you've got going on and how anything's different with COVID.
Everything's different with COVID. Thank you so much for having me. My name's Katie. I'm the nurse manager for the Lewiston CBOC. And so from the email that I received, that you wanted me to discuss, just services and how we're going to look post-COVID. So I'm going to kind of do that. So we see about 14,000 patients a year. We're the second biggest CBOC in the state. CBOCs are in all the way from Caribou, Holton, Fort Kent, to Calais, to Bangor, to Lincoln, Rumford, Portland, and Saco. So in Lewiston, we have optometry, audiology, primary care, mental health, rural health, telehealth, pharmacy, lab, and radiology and ultrasound. So we have an array of services that are offered at our clinic. Pre-COVID, we were, very busy on a day-to-day basis. We would see anywhere from 200 to 400 patients a day. That's obviously not going to happen post-COVID. We're currently working on a lot of different plans to eliminate touch points, eliminate exposure to other people. We are ramping back up as far as services. We've never closed services. We've just offered services in different modalities. So what does that mean? We have been doing telehealth visits, we've been doing phone visits, and then we are reserving the face-to-face visits for the absolute needed. We have still been doing behavioral health injections, labs that are urgent based on medication management or a chronic condition. And there's just some things that you just need to see you can't do via video. Post-COVID world, like I said, we don't really have a rule book. We're kind of making this up as we go. Our biggest priority is to keep people safe, to keep people distanced, and to continue to flatten the curve. The tricky part for us right now is that we suspect that there will be another resurgence of COVID, probably during flu season. So we are trying to get people in now and kind of tucked in, if you will, so we can eliminate services as needed if this does resurge. If it doesn't, then we have a plan, and it's all based on triggers, and it is going to be a phased-in approach. And I like it because it's fluid, so we can always go back to phase 1 versus phase 4. So that's kind of us in a nutshell. We're still doing a lot of virtual mental health groups. We're doing addiction group, hope group, insomnia group. We're really lucky in the VA that we have that modality to do that and reach out to our patients. We've actually had a really good showing, just kind of like what you and I are doing now. We do that in a group setting. Guided meditation. I have a list. Stress group, medics group, diabetes support group, smoking cessation, living with anger, a bunch of addiction services, and PTSD group. I think that's just offered in Lewiston. The good thing is that, or one of the silver linings, if you will, from this COVID is that because more and more people are doing this kind of modality for meetings and groups, a provider in Bangor could see a Lewiston patient for a different group or a different service that we normally wouldn't offer. So we're starting to do outreach like that. I held a group on mindfulness the other day, and I had somebody from Madawaska. So we're trying to reach the most veterans that we can, keep them engaged, and you know, as we keep staff and, you know, patients, everybody safe. So that's my little 5 to 10 minute spiel. And if you guys have questions, I'd be happy to answer them.
I always have questions, but does anybody else want to go? So I guess I'll just kind of hit you with kind of the big one for me, and then we can go from there if others have questions, or we can just jump into Jerry with the vet centers and then come back to a bigger Q&A. But so and kind of talked about this last week, I'm one of those terrible people that has never signed up for VA healthcare. And at the, I mean, there were a lot of reasons that went into that, but one of just, and I think it's probably a common thought process, is I don't want to go to Togus for healthcare. You know, at the time I lived in Sanford. I don't want to go all the way up to Togus anytime I need something done. And it took a while before I was familiar enough with CBOCs and the services kind of that they provide. Now, what sort of services can't you get done at CBOCs? Like, what would force you up to Togus? If, you know, if this was something I was interested in, what kind of...
Yeah. That's a great question. Thank you for asking that. You know, obviously, we're starting to see more specialty in our clinics. We do see pulmonology, cardiology, and GI in our clinics on a rotating basis. So basically, you would go to Togus. So if you think of the whole state, we're very rural. So what we're trying to do is we are trying to get specialty providers out into the clinic. There's a lot there, and every clinic has a different, you know, subset of specialties that they would see. So for me, having cardiology, pulmonology, and GI, they would see the provider in our clinic in Lewiston. But if they needed a scope of any kind for like a GI, or if they needed a cardiac cath for something, we can't do that in the clinic. So then you would go to Togus for that. But all follow-up and pre-op are being done in the clinic. Does that answer your question?
Yeah, that's great.
Yeah, so you would need to go. We don't have many ORs in our CBOCs, and we don't have, you know, that capability or the staff. However, we have been approved to build a new CBOC in Portland, which is going to be very large. It's going to double the footprint that we have in Lewiston. Multi-story. The second story is just going to be specialty care. So I would suspect to see much more availability for specialties like podiatry, dermatology, things like that. And I mean, this is the beginning stages, but they're talking about even maybe having a procedure area for low risk procedures. In Bangor, there's a dental clinic. So they're doing dental cleanings in Bangor. So there's just it depends on the need of where the CBOC is and what the community needs. It's working with community partners, but we do try to keep people from going to Togus unless it's like the big operation. If you need your gallbladder removed, we can't do that in the CBOC.
Great. Any other questions for Katie right now? I have another good one, but it'll apply to both you and the vet centers. So we'll wait until Jerry can wow us with his life-changing words.
Okay, wonderful.
All right, you ready, Jerry?
Yeah, can you hear me?
Can hear you just fine.
Awesome, awesome. My first experience with Zoom, so this could be a bad thing. Well, all the vet centers are still currently functioning as normal. They're not taking any, there's no face-to-face visits going on. However, unless it's a crisis situation and somebody walks to the door, then we'll do the screening and we'll mask them up and glove them up and bring them in. send them down and take care of them. And then, of course, do the cleansing after we resolve the issue and send them on their way. We are still functioning. We do have every vet center in the state is open. Every vet center has at a minimum of 2 people in the building, and the rest of the clinicians are all working telehealth. They're still conducting their client sessions, still assisting with any outreach issues, any education issues, any questions, anything like that. We are still doing that. The only thing that's really changed is that we don't have anybody in the building. So we're still business as usual. You know, yeah, food pantries. People call in, ask for some assistance. We'll bag some stuff up. We'll leave it outside for them to come and get. When we'll give them a time frame to be here to get it, and we'll set it outside for them. Grab and go.
Great. Now for folks that maybe aren't familiar, or this session's being recorded, Jerry, so it can be shared down the road. So for folks that maybe aren't even a little bit familiar with the vet centers, what do you do? Why would I go there? And are there specific sort of eligibility requirements, or
okay, all right.
Pretend I don't know anything about the vet centers.
All right, well, that's what we'll do then. Actually, the vet center program is created for combat veterans who are struggling with transitioning back into society after returning home from their tour duty. Now, however, seeing as everything is slowed down, which is a good thing, the vet center program still provides readjustment counseling for veterans, military sexual trauma counseling, and bereavement counseling for Gold Star families who've lost loved ones on active duty. We help with the educational aspect, GI Bills. We get them connected with the VA folks, make sure they get taken care of on their health benefit side. We also help them get them connected to veteran, like Maine Veterans Services, for example, and get them connected with those folks to get their benefits for disability claims, anything along that line. And each vet center is unique in the fact that they conduct their own type of groups. For example, Sanford does a guitar group. Bangor does a painting group. Here, book groups are pretty much prevalent throughout all the vet centers. There are over 300 throughout the country. There are over 1,800 community access points, which is, if, for example, Togus is the hub, the CBOCs are the access points. The vet centers have that same setup. Lewiston, the Lewiston Vet Center is the brick and mortar facility. Our community access point is the Veteran Resource Center in Brunswick, University of Augusta, UMA, we have their resource center there. We go to Rumford to the CBOC there and provide services there. We have Wilton and Clinton, where we have a contact fee program. We also have the capabilities of the mobile vet center. I don't know if anybody's seen it. We have a new one this year. It's a 40-footer. It is designed to go to a location, set up, and see veterans there, provide them services and those same things.
Awesome. Have you been able to take it out yet, Jerry?
Oh yeah, I've been out and about, but then we shut down. So the truck is immobile at this point. We'll use it actually. Just a little heads up. I don't think everybody got this information. I'm sure everybody's heard about it, but the Food for Vets program is going on right now, and there's a if you go to the website 222cares.org, you can click on their resources page, and it'll show you everywhere that they're going, dates and times. They'll be here at Lewiston next Tuesday, the 12th, from 9 to 2. So veterans can go there and sign up and come here and pick up a box of food for 14-day supply. And then in Topsom, they're doing it at the American Legion Post. And it's happening in Machias, Ellsworth. It's already happened in Bangor. It's happened in Arundel. So it's coming through the state this week, and yeah, the last date I saw in Maine was like the 11th of, well, actually the 13th of May.
Oh, that's great, and I actually had no idea. That's
yeah,
great.
And yeah, it's get it out there to the veterans. They can sign up online. They can drive up, proof of ID. You know, they got to validate that they're a veteran. Once that validation's done, they open up the trunk, throw a box in, send you on your way. Never have to get out of your car. It's like a drive-through.
Fantastic. All right. Anybody got any questions for Jerry on the vet centers? Quiet group today.
Right.
All right. So here's my big one, and you can, since you're still unmuted, you can kick us off, Jerry, but it applies to you too, Katie. So I have already mentioned that I didn't want to drive to Togus. We all know Maine's super rural. We know transportation is an issue for a lot of folks. We'll pretend for now that internet's not an issue, but we know that it is. So COVID is its own unique beast, and we get that. What do you think this will change for the future of the services you provide remotely? Do you think there will be more telehealth options, or do you see this expanding and lasting, not just a temporary solution for the crisis we're in, but do you think this will continue forward post-COVID?
That's a really good question, and it's unique to each entity. The Vet Center program here in Maine takes its guidelines from our district office, which is in New Hampshire. So the guidelines that they're using, it's not so much state specific. They're trying to make it that way, but it's like you said, it's fluid. As it currently stands, there is going to be a push for more telehealth. It's a generation. It's an evolving situation. The only thing that could really slow that down at this point is the number of available secure platforms in which to use to provide that service. Right now, the VA system is inundated. It is overwhelmed, actually, with the amount of telehealth being done. So it depending on what platforms you're using, you can get kicked off rather easy. So.
Awesome. Thanks, Jerry.
Yeah.
How about you, Katie?
That's a great question. And like I said before, we don't have a playbook. So we are kind of going at, learning as we go, if you will. But yes, telehealth is here to stay. We received a very large grant before all of COVID to push telehealth services for especially our rural veterans. So this is just magnifying it. The numbers that are coming out of people doing telehealth visits is astounding. I'm so proud of our veterans for taking the leap of faith and trying it out. And a lot of them before, it was just like, oh, I'd rather just come in, or oh, I don't have a computer or I don't have a phone, but we have equipment to give veterans. We have people doing test calls and trying out all the trials and tribulations first. And it's been working. So fingers crossed that we will see more telehealth services. And, you know, personally, even in the private sector, that's what like my doctor is pushing out is more telehealth services. And as a busy working mom, it was really nice to get lab results via a telehealth visit instead of taking the time to drive in, you know. So there are pros and cons, but we're focusing on the pros.
Katie, you mentioned the equipment and the grant that you guys received for the rural veterans.
Yeah.
Can you speak a little bit about how, like, someone that doesn't have a computer or working internet, and they're just struggling to be able to arrange telehealth services?
So we do a lot of tracking. And you think Maine is very rural, which we are, but the amount of veterans who don't have a working internet is actually very low, which really kind of shocked me when I saw the map. So we do have tablets that are available, and we issue them. We have telehealth techs that do the test phone calls. Obviously, you know, there's some areas that just don't have good cell service. So we are working with, you know, local modalities to help, you know, foster a relationship to get veterans the internet that they need. So we have a whole telehealth service line at the VA that has been working in concert with a lot of different modalities and different service lines to offer some sort of telehealth. It's not I'm not the telehealth service chief. So I have seen that website about the internet, and I remember being very like, oh, I thought that number of veterans who don't have internet would be much higher, but it actually wasn't that high.
That's great. So you would just recommend them reaching out. Is there a specific department or number that they should call?
Yeah. So basically, what we're doing now is that if at the CBOC we are calling the patient and saying, "Hey, you had a patient with Dr. So-and-so. We're wondering if you would be willing to switch from a face-to-face to a telephone or a telehealth visit." If they say the telehealth visit, then we then arrange for the telehealth tech to call them to get the equipment needed to set up everything, do the test call, and people are fine. It's literally an email that they send to you that you click, kind of like what I did today, and that's how it's done. We've really streamlined it. So I can do it. Anybody can do it because I am not savvy when it comes to this stuff. I may have signed into this meeting 3 times.
That's great. That's good to know that there's the hardware and the equipment that you guys are able to provide.
And we have headsets, and we have all kinds of fun little things. It's also a nice way because, you know, when you come into the clinic now, you're masked. So a lot of patients who are hard of hearing and rely on reading lips are choosing this modality because with a mask on, it just causes another barrier.
Great. And then I also had a question about, so for someone that hasn't applied for VA Health, are they still able to do that through the CBOC?
So we're not doing walk-ins right now. So you'd have to call the benefit administration line or just the CBOC, and we can transfer you and direct you. We've added that to our repertoire of things. I pretend that I have a utility belt, and sometimes I'm the cleaner, or the escort, or the nurse manager, the police officer, whatever is needed. We're just learning as we go. But yes, if they call the CBOC at 330-2700, we will direct whoever where they need to go.
Great, thank you.
I have a question.
You're a little quiet, Bob.
Oh, okay. Nobody was. Anyway, it says 230,000 people in the state of Maine. Am I about correct?
Can't quite hear you.
How about now?
A little better.
Yeah, I'm gonna have to change mic. anyways, there's supposed to be 230,000 people in the state of Maine, and 130,000 of those are veterans. And Togus is struggling to maintain that type of health care. And I was wondering if anything can be done or get a hold of Senator Collins or something to reinforce more financial ability for the state of Maine to help more veterans, or is this as high as we can go?
I think I heard your question. And you know, it's a tricky, you know, we're the biggest system in the country for healthcare. So there's a lot of moving parts, changing parts. I do know that we do work with our congressionals, and we do, as far as Togus goes, I don't feel comfortable speaking on that. That's just because that's not my wheelhouse. I would hate to give wrong information. But I can point you in the right direction with who to talk to, but I do know that they are ramping up services at Togus as far as who they're getting for specialties, for different services. And we are trying to work in concert with private sector to work on getting services for our veterans. I can't hear you at all now, Bob. I'm sorry.
Oh, I don't know. I'm having problems with my mic, I guess.
No, you're good. I had snuck in and muted you while you were hooking up the mic.
Any better? I don't know. I've had a problem with my audio recently. I don't know what's going on with it. I'm going to have to get into it, I guess. You said you know somebody you could go to for this?
Yeah, I can get you in touch with somebody at Togus who would be able to, you know, answer your concerns or your questions. I have an email from somebody who emailed me to ask me to be here that I can forward that information to.
I wonder how possible it would be to get the veterans together and protest against not getting enough money.
Again, that's out of my wheelhouse, and I'm just not going to comment on that. I'm sorry.
I guess we're very limited. Okay, we'll move on. Anybody else?
What else do we got? I mean, I always have questions. So part of this presentation was definitely meant to balance out, you know, kind of physical healthcare needs as well as the mental health care needs, which is why it was important to have Jerry and the vet centers represented. Now, for folks that aren't eligible or don't meet the criteria for the vet centers, what are their options for kind of mental health services through the VA? Or it's just
well,
not
they do group meetings, they do one-on-one counseling. I listed off the groups just in Lewiston, and they're always coming up with ways to meet the needs of the specific veteran. You know, like I said, we're still seeing some patients. Obviously, if somebody came in an acute crisis, we would see them at our CBOC. So I think that we have a very robust mental health options for the CBOCs and for Togus.
great.
Hey, just a heads up, the vet center will see anybody right out of the gate for at least 5 visits until we can confirm that they meet our criteria. Our criteria is mandated by Congress, so we don't really have a say in that. However, we can get, you know, we'll see anybody, and we will definitely do a warm handoff to any provider that will meet and take care of our veterans. I mean, that's just how we operate. So we work hand in hand with the CBOC and Togus, our post 9/11 teams, our, you know, suicide prevention teams. We work with these folks on a regular basis to make sure that everybody's getting what they need.
Absolutely. Thanks, Jerry. Other questions?
I'd like to make a statement. I talked with my doctor yesterday over the phone, and I have my own equipment, and I have taken my blood pressure and whatnot, and I corresponded with Togus that way, and the same way with the CBOC in Lewiston. So there is a lot of communications, and they don't want to see you unless there's a problem where they have to see you in person. Otherwise, you can do everything by phone or by computer.
That's what we've been trying to do, especially during this COVID crisis.
No, I think that's great. This might be a little bit out of your wheelhouse, Katie, but last week I think Stephen, you brought up that some of the comp and pen exams were being done remotely, if possible, when possible. That back to what I asked earlier, that's an area I'm especially interested in, if it's going to continue like past the COVID period, if they're going to continue with some sort of remote way of doing some of that. Obviously, the range of motion you can't really do over Zoom or whatever service. But do you think have you heard anything about that specifically?
So again, it goes in phases. We do have a comp and pen practitioner at our CBOC who's been working remotely with full plans of coming back when safe to do so. I don't know what phase she will be in, but that is the plan.
Anybody else? Well, looks like this was a nice, easy one then. Katie, Jerry, is there anything else either of you wanted to add in before we?
No, thank you for having us, or having me, and Jerry too.
No, I'm good. Thank you for allowing us to spread the word, because we need to let our veterans know that we're still here for them, and we're still
Absolutely.
working for them.
I echo that. We are absolutely still here for our veterans, and even if it's in a different modality of seeing you, we are still there to coordinate care and work in unison with other services.
Most definitely. Most definitely.
Great. And I think that's definitely the big message we want folks to take away from this, is that, while it looks a little different, business is moving forward, and anybody can get the help that they need, or whatever they're looking to get done. So I will go ahead and stop recording.